to call our December 2nd STIF Advisory Committee meeting to order. I'm Josh Kaczynski. I am your vice chair. Our chair, Dave Reeser, couldn't be here tonight, so I am going to be leading the meeting. And I'm going to start off with the roll call. So when I call your name, just let me know if you are here or not. Carmen? Kelly? Gino?
Here.
Thank you. Joshua Kaczynski, that's me. Okay, I'm good. We got two Joshes here. Pete? Here. Okay. Scott? Here. Bart? Here. Chelsea? Joshua Myatt? Cassette?
Here.
Dave Reeser is absent. Carrie?
Here.
Vidal?
Here.
Okay. Our second agenda item is agenda review. So we are going to have a public comment period, followed by a presentation of Diamond Express and Rotary Express, two STIF-funded projects. We'll have an update on the LTD coordinated plan presented by Lane Council of Governments and Lane Transit District staff. And then we'll have some staff updates and future agenda items. So hopefully we can move through this in a timely fashion. So public comment, are there any members of the public who signed up to comment on the sheet or online?
Nobody in person, and I don't see any hands raised online.
Okay. So I'll go ahead and close the public comment period and move along to our first agenda item. Kathleen?
Thanks, Josh. In October when we met, we started our tour of STIF-funded projects in Lane County, and we started here in the center of Eugene with the downtown circulator project. So I thought this time around we would move out into the more rural areas of Lane County, go to our eastern and western corners and look at LTD service in both Oak Ridge and in Florence. If I could get the next slide, please. Thanks, Bree. So the Diamond Express is LTD's service that operates between Oak Ridge and West Fir and Eugene. It connects two geographically isolated communities in Oak Ridge and West Fir to the Eugene Springfield metropolitan area. And it really provides a vital service for folks who are commuting to jobs in Eugene or coming to school in the area as well, or anyone who just wants to come in for social or business purposes. We run 4 round trips on weekdays on that service, starting early morning for commuters, then a mid-morning trip, a mid-afternoon trip, and a late afternoon or early evening trip for commuters who are going home to Oak Ridge. On Saturday, we do 2 round trips. We have a very reasonable fare on this service. It's $2.50 each way, $5 for a round trip service, and that round trip fare includes a complimentary LTD day pass. So folks who are coming in to, for example, in the early morning for a job or to go to school, they can get off here at the Eugene station, they get a complimentary day pass, and they can just use that to ride all day back and forth on LTD's fixed route service here in the metro area. And the last thing I wanted to point out is that LTD contracts for this service. So we contract with a public transit service provider called Pacific Crest Bus Lines, and they provide the service for LTD using LTD vehicles, but their own drivers. Yeah, got that. Thanks. So how do we fund this service? Both of these projects that I'm talking about tonight get STIF funding. They get different flavors of STIF money. Those of you who were on the committee earlier will remember that we looked at STIF discretionary grants. Those are 9%. So the state gets all the STIF payroll tax funds in. They take 9% of that and they put it into what they call their discretionary grants. Those are competitive grants. They're open statewide, and you submit a grant application and compete against everyone else in the state who's going after those dollars. LTD has been successful for a number of STIF funding cycles in a row in obtaining STIF discretionary intercommunity funds for the Diamond Express. Those are funds that are specifically set aside to connect different communities, especially in this case, a rural community to a more metropolitan area. It helps support what the state calls the statewide transit network, which is to make sure that as much of the state as possible is connected by public transit. The STIF discretionary grant requires that we put up 20% match, so we use STIF formula funds for that match. And then we also get a small amount of local funding from the city of Oak Ridge for the Diamond Express. I added the fare box revenue in there just so you could see that fare box revenue makes up a very small proportion of the funding that we get for this service. All told, over the 2-year period, that works out to about $874,000 to operate it over 2 years, or $437,000 to operate the service each year of the STIF biennium. So how many people ride the Diamond Express? One thing that's interesting here is that we did a service expansion in early 2023. We added an extra route on the weekdays. We were running 3 weekday routes, and we're now doing an extra service in the afternoon. We added a mid-afternoon service that's been incredibly popular. It actually makes up about 25% of the rides each month. We also added Saturday service, which has not been as popular. We were expecting it to be popular. It has not been as well used as we would like it to be. But you can see that we've had, at least up into this current year, we've had a nice increase each year in the average number of rides each month. In the first 3 months of fiscal year 26, we've seen a bit of a decrease, and we're seeing that across our rural services right now. I'll talk about that a little more when we get to the Roadie Express, because we're seeing the same pattern there, and I'll talk about why that might be. Any questions about the Diamond Express before I move on to the Roadie Express? We'll also have time at the end for questions.
For Kathleen.
Okay. So the Diamond Express runs between 2 cities. The Roadie Express runs right in the city of Florence. It's sort of like the fixed route service that we have that goes all through Eugene and Springfield. It runs a north-south route in the city, so any of you, well, I'm sure everybody's familiar with Old Town, that's as far south as it goes. It goes all the way up to the Fred Meyer, that's at the very north of the city. It does get some tourist riders, but we serve a lot of local residents, and we make a lot of stops that are important for those residents. We stop at 4 different grocery stores, the City Hall, the Public Library, Peace Harbor Hospital and Medical Center, the local food bank, the local Senior Disability Services Office are all stops along the way. And last year, over 60% of our riders on the Roadie Express were folks who are over 65. So it's a very useful service, especially for older residents in Florence. It runs every weekday, not weekends right now, but Monday through Friday from 10 to 6. Currently runs every 30 minutes. Also reasonable fare, $1 per trip or $2 for a full day pass. And like the Diamond Express, we contract for this service. We contract with a local provider called River Cities Taxi in Florence. LTD provides the vehicles, and River Cities Taxis provides the drivers, does the preventive maintenance on the vehicles, and oversees the service in general. And funding for the Roadie Express. So the Roadie Express is paid for primarily with STIF formula funds. Unlike the discretionary funds that I talked about for the Diamond Express, we don't have to compete for the formula funds. Those are payroll tax funds that are allocated to Lane County as part of the formula program that ODOT uses. We also use some other sources of funding to pay for the Roadie Express. We get some Section 5311 funds. Those are federal funds that come to the state of Oregon, and those are particularly for public transportation in rural areas. And we get some local match as well for the Roadie Express, this time from the city of Florence. And again, you can see fare box revenue fairly low, doesn't make a huge contribution toward the cost of service. And just to give you the total for that, the total Roadie Express funding over 2 years is about $972,000. or $486,000 for each year of the biennium for operations. Thanks, Bree. I can do the next one. Oh, you got it. Thanks. We also did a service expansion with the Rhody Express. We did it in June of 2024. We doubled service frequency. So we had been running service once an hour. In 2024, we increased that to every 30 minutes. And as you can see, we had widespread and quick acceptance of that change. Average rides almost doubled over the course of the year when we implemented the service increase. So we went from 543 trips a month up to 988 in the following year. And again, here in the first few months of fiscal year 2026, we're seeing a bit of a decrease in ridership. We're seeing about a 10% decrease there. And we are trying to figure out what that is. As I mentioned, we're seeing that across rural services. We're seeing it, like I said, on the Diamond Express. We're seeing it in the Rhody Express, and we're seeing it in our Cottage Grove services as well. We've looked at various possibilities, declines in tourism. We've talked to the city of Florence to see if they have any ideas, to our contractors as well. And it's a little bit up in the air right now. One possibility is that it's an early indicator of a move toward a less robust economic situation in the state. So that's a possibility, but we don't know for sure at this time. If any of you have any thoughts about why that might be, I'd love to hear them. So feel free to pipe up and share those.
Well,
Yeah, Vidal.
question. And again, I don't know all the nuances around bus operations, if you will. I know that for the Oak Ridge ride, it's $5 for the whole day, plus you can take other legs or what's not. Would there be a possibility of individuals seeing that price and using that to their advantage, where they go out and try to take multiple rides during, let's say, 2 days a week, rather than doing a usual everyday type situation, simply because, I guess, like you were indicating, economic situation is kind of hampering things, so they're trying to optimize the price versus where they can go based on where the service could take them. And I'm assuming that for both Oak Ridge as well as the Florence one.
Yeah, that's absolutely possible. That would make sense, especially if people are starting to hurt economically.
Is there a way we can tell between the same rider taking multiple rides in one day versus that rider taking multiple days? At
this point, we can't, but we are hoping within the coming year to get electronic fare validators on all of our rural services, and that will give us a much better sense of who's riding.
And again, we don't want to be tracking riders. We're just trying to understand what's their need versus what they're actually trying to achieve.
Yeah, exactly.
Thank you.
Carrie.
Just quick question on the fare for the Rhody Express. It was $1 one way, $2 round trip.
A day pass.
Day pass.
Yeah.
Remind me, what's the in Eugene Springfield area day pass and one way trip?
One way in Eugene Springfield is $175, and a day pass is $350.
So it's less expensive
It is less
there to ride the
expensive.
Rhody Express. Okay, great. That's what I was thinking.
Yeah. Other questions? Comments?
How many stops do you have in Oak Ridge, Westford? Do you know by chance?
That's a great question. We have 2 stops in Westford, one of which we always make at the Oak Ridge Middle School. We have another stop further into Oak Ridge that we make on the first run of the day and the last run of the day.
Oh.
And then we have several stops within the city of Oak Ridge. And we also have flag stops in Oak Ridge. So if you're not on Highway 58, you can flag the bus down at any
I
point.
didn't know that.
Yeah.
Does it stop anywhere between Oak Ridge and Springfield, Eugene?
It does not.
Okay.
Yeah. It stops at Westford and then heads into the Eugene area. Its first stops in Eugene are on Franklin, right by the University of Oregon.
And so is there any service that serves Pleasant Hill area?
There's no service that I'm aware of right now that serves Pleasant Hill. LTD does have a bus that goes to Lowell.
Okay.
Yeah.
And on the weekend for the Oak Ridge stop, what's the times for those two stops?
Early morning, leaving Oak Ridge at 7, I believe, and returning to Oak Ridge around 7 in the evening.
Oh, okay.
Yeah. It was really designed for people who wanted to do weekend,
It's tough.
fun stuff. We also thought it might get more pickup for folks going from Eugene to Oak Ridge for recreation activities, but we haven't seen as much of that as we had hoped to. Yeah, Bart.
On the roadie, it starts at 10 o'clock.
Yeah.
The rest of these services start a lot earlier.
Yeah.
So is there a reason why they wait till 10 o'clock to run fresh bus?
I don't know. That's the way it's been for quite a while. We have talked about starting earlier as we think about future service expansions down the line. We've thought about starting it earlier to get commuters who want to ride the roadie to work.
Right.
And we've thought of other things as well. For the Roadie Express, there's always a lot of requests to have service that goes to the beach directly. So we thought about that as well. We'll continue to see how ridership trends go as we plan for the future there.
Good.
Yeah. Carrie.
One more question
Yeah.
on the Oak Ridge one. You said you expected to see more recreational users. Are bikes allowed on
Yeah.
the Diamond Express? Okay,
Yeah.
so people could take their
Bikes are allowed. We have bike racks on all our vehicles. Yeah. All of our vehicles in Florence as well have bike racks, and all of our vehicles are fully accessible as well.
That's true, because that's what I do.
Yeah.
It's pretty much the entire city staff. Getting it right there.
We have time for, I think, one more question or comment for Kathleen.
I think I can, possible.
Comment.
So I realized when I was first moving here to work here that the timing is mainly for recreational and not really for working in Oak Ridge. So basically whenever I looked up the times, it was either I had to go in super early or super late and then come back super early, and that wouldn't make enough hours for a regular 8-hour workday or even a 12-hour, which is more so found in Oak Ridge. And then I also think that the difference in prices between Eugene and Oak Ridge also is just a hiccup for some people, because I know that when I used to take transportation a lot, like the difference in cents going from like the MTA to like the Long Island Railroad it was only a couple cents difference, but it's like I already had to count the quarters before I got here.
Yeah,
So it's
yeah,
like,
yeah,
you know,
yeah.
so I feel like that was the two things that I mainly saw with Oak Ridge and transportation right now. And also just that the bus stops are pretty much like stands. Like there's not really a place where someone can go like to actually stay and wait for these buses for a long time if they are stranded there, and there's no other way out of Oak Ridge if they do end up stranded after the 5:30 p.m. mark. And I think it's just difficult for people to do these things and come to Oak Ridge with more of an idea of just like actually working and spending time there. Because when it comes to recreational, I feel like most of the bike people use our own shuttle services that we have available because they're cheap as well.
Yeah.
And they fit more people.
Yeah.
And for like actual recreation within the city, it's only the bus, and it comes within hours where people are either at work or rushing home to.
Yeah. I think the commuter situation has been set up primarily for folks who want to commute from Oak Ridge to the Eugene area for work. That's why it leaves Oak Ridge so early and returns to Oak Ridge so much later in the evening. Yeah, but thank you. That's really helpful to know.
Thank you. And thank you for that presentation, Kathleen. So we're going to move on to our next agenda item, which is the LTD Coordinated Plan update. And so, Dave, I don't know if you want to start things off.
Yeah, just really quickly. So, good evening, Stiff Advisory Committee. My name is Dave Roth. I'm the Director of Mobility Planning Policy. And I think I know most of you, but for those who haven't met, it's nice to meet you. And so I oversee the planning functions at LTD, and I just want to take this opportunity to introduce one of our new team members, Carrie Asklar, who just joined us. I think this is your 3rd week at LTD? 4th? Okay. Pretty new at LTD. We're really excited to have her on the team, and we might have mentioned this at the last meeting when we met with you last month when Dan and Brandon were here, that we were going to be transitioning to a new project manager for the coordinated plan update. So Carrie's going to take on that role, and I just wanted to take this opportunity to introduce over to you, and Carrie and Dan, you can take it from here.
Yeah, thank you, Dave.
Thanks.
I just want to quickly introduce myself to this committee. I'm really excited to be here. Again, my name is Carrie Asklar. I'm a planner on LTD's planning team. And I'm excited to be stepping into this role. I have a long history of multimodal planning, really thinking about how can transportation really serve community and really help us meet our sustainability goals. So that's what really fuels me. I'm also I really love talking to people about their transportation needs and how they get around or how they don't get around. With that in mind, I'm really excited to be here at this committee to really listen to your experiences, to keep coming back at future STIF committee meetings. So that's all I really want to say. So thanks again for being here tonight. I'm really excited to listen to you and to be taking some notes. I may jump in from time to time, but I'm going to really use this moment to pivot it to Dan at LCOG. So thanks, everyone.
Thank you. Brianna, can you bring up that presentation? I'm going to start just by saying I'm a very quiet speaker, so I'm going to try to speak loudly here, but if you're having a hard time hearing me, don't hesitate to let me know and remind me that I need to speak up. So this is the Lane Coordinated Plan. My name is Daniel Collister. I'm a planner at the Lane Council of Governments, LCOG we call it. You may recall seeing me in October. I presented to this group I introduced this plan idea and what it is a little bit and some preliminary elements of the plan. Today I'm going to introduce a couple new elements of the plan that we've been working on. Before I do that though, can you advance the slide please? Here is a quick refresher on what the coordinated plan is. So Lane Transit District receives Federal Transit Administration Section 5310 funding, specifically for projects that improve mobility for older adults and people with disabilities. One of the requirements of that funding program is that the project need to be listed in a coordinated plan. So LTD has maintained a plan. Their current plan was last adopted in 2019. So it's getting a little outdated, and they have contracted with Lane Council of Governments to help update this plan. So as I mentioned, with the Section 5310 funding, you may imagine this plan really is focused on improving mobility for older adults and people with disabilities. It's not a broad general plan for LTD. It's pretty narrow and focused. It can be more than that, but it needs to be, its real focus is that. So it does include identification of stakeholders and needs. There's an inventory of services that exist, and we identify gaps and overlaps in the coverage. And ultimately, there's a project list where we're prioritizing with some strategies for how you might guide investments in the future, both for Section 5310 funding and perhaps for STIF funding as well, or others. So for that reason and other reasons, we thought it made sense for this group to serve as the steering committee as we're developing this plan. So your role as the steering committee is really to steer the development of this plan. We're going to be presenting not finalized chapters, but really draft elements of this plan for you with plenty of opportunity to steer how that plan is developed. So this works best if there's a lot of interaction and feedback. Please feel free to comment. We'll have a couple opportunities in this presentation where we'll pause for discussion, and I hope that you're feeling vocal today because we'd love to hear from you. Next slide, please. Here's just a quick overview of the project timeline. We've been working on this for a while, since the spring. We're anticipating LTD board adoption of the plan in June of 2026. I've identified a few touch points here on the bottom where I'll be presenting to this committee, providing some updates and receiving direction from this group. In October, I presented the policy assessment and just some administrative stuff. Today, I'm going to be introducing the evaluation of existing conditions and the needs assessment sections. You can see the next section, public engagement there. There's a lot of public engagement we have planned for this, and that public engagement is going to serve to inform the content of those other sections. So, for example, the needs assessment, which I'll be presenting today, relies heavily on the input from our outreach and engagement. So what we're presenting today is really just an outline of what we're anticipating that section will look like and how we're planning to complete it. So plenty of room for feedback and steering how that section in particular is to be developed. Ultimately, what we're anticipating from this group is a recommendation for the LTD board to adopt this plan at their June meeting. We're anticipating that recommendation in May. So next slide, please. So the first section I want to talk about today, the evaluation of existing conditions. This has 3 subsections. In that first, we're taking some demographic data. We're looking at census and doing some geographic analysis to help us visualize where certain populations are, where certain densities are. We're going to be identifying providers and doing an assessment of the services that are available throughout Lane County. Next slide, please. Here's just a quick overview, very high level, countywide population density. This section, we're going to dive in much more deep into this, looking at certain segments of the population and doing some profiles of them. Could we go to the next slide, please? So for example, here we see, this is a population density map showing population with a disability throughout Lane County. We have several of these and some write-ups accompanying this, helping to analyze the data that you're seeing, interpret it a little bit in a way that can be useful for this plan in identifying where are those gaps in services, what are the opportunities, and where are the overlaps. Next slide, please. So for example, here's a population profile for residents living in poverty. There's a write-up, a narrative, some numbers, and a map showing that distribution. We'll give the same treatment to a number of different segments of the population. Can you go to the next slide, please? So of course, we're interested in older adults and individuals with disabilities. That last slide, we showed households living in poverty, but we're going to do the same treatment for these other segments of the population as well to help inform the plan. Veterans, zero vehicle households, limited English proficiency, and people of color. Next slide, please. The next part of this section is a summary of the services. So we've grouped, categorized these services into 4 different groups here. Fixed route bus service. When we say that, what we mean is, for example, LTD's numbered buses. These are buses that follow a fixed route, as the name implies. They have designated stops, follow a schedule. Rhodey Express is another example of that. Diamond Express, Link Lane. The meeting materials has a much more comprehensive list. Here I'm just giving you an idea. The next group is demand response service. So when we say that, we're talking about ride source, paratransit, for example, but also rural shuttle services, and the Cottage Grove connector, for example, is another that we're putting in this group. When we say other services in Lane County, we're not limiting ourselves in this inventory to just public transportation, but also private service providers, nonprofit service providers. So this group includes taxis, it includes Uber and Lyft, but it also includes non-emergency medical transportation. It includes Peace Health rides. And this final group, services connecting to Lane County. Here we have Amtrak, for example. We have Cascades Point, which is the bus shown there, Pacific Crest bus lines, and others. We'd love for this list to be comprehensive. The meeting materials, we've attempted to do that. We'd love your input on that, but for the time being, why don't we move on to the next slide. This map is just showing, just giving you an idea of where fixed route and demand response services exist throughout Lane County. There are a lot of caveats that go with this, but just gives you a general idea. Next slide, please. So each of the services we identify, we're going to give this treatment. We're going to have a service profile, write up a little bit describing the service, some data along the top, hours of operation, a description of what that service is, a map showing the areas served. Here we're showing the Rhodey Express in Florence with the routes identified, the service area. This this treatment for each of those services, together with the demographic information and with the input that we receive through our outreach and engagement efforts, is going to inform the content of our plan. Help us identify where there's overlap, where there's needs and gaps. Next slide, please. So we're still working on this section, but we have had some time to look at the data, and there are a few highlights so far in what we've seen. So let me get this right. A few that I want to present here. Taken together, public transportation services provide access to 87% of the population of Lane County, and that includes 86% of the population with disabilities and 82% of older adults. Excuse me. Another point I want to highlight is that Florence perhaps presents a unique vulnerability or opportunity, depending on how you look at it. Demographically, it is a bit unique in Lane County, where older adults make up 40% of the population of the city of Florence. Compare that to a countywide percentage of 20. So interesting opportunities there when we're talking about serving particularly older adults. Along similar lines, we're finding that rural areas of Lane County have a disproportionately high percentage of both older adults and persons with disabilities. That's outside of the urbanized area and outside of incorporated cities in general in Lane County. So speaking of like a servants coming from a service efficiency standpoint, that presents a challenge. Next slide. So as I mentioned, we're really wanting to solicit input from this group, and we included some questions in your meeting materials, hoping that you had some time to review those and give them some thought. We'd really like to open up a discussion here. We've got these questions to get the ball rolling, but we really are just trying to open your mouths. So let me go through these, but don't feel like you have to limit your comments to these questions. We've been looking at a lot of data. We know that data doesn't tell the full story. You know, what are the nuances to the data that are being missed? Are there other important considerations that we should keep in mind as we interpret the data? We mentioned in the last slide 87% coverage. You know, does that actually translate? Does that turn into usable services, particularly for older adults and people with disabilities? I'm guessing not. Maybe through your personal experience with the people that you work with, you have better information than the data that we're looking at here. And we have a more comprehensive list in your meeting materials of the services. Are there some that we're missing? Again, we're not limiting ourselves to public transportation services. Are there other services that belong on that list that we've maybe overlooked? So with that being said, I'm speaking too much here. I'm going to rest my voice. Yes, go ahead.
So I got a question. You see, so we got 87% coverage throughout the county, correct?
Is that correct, Joshua? He's been our data guy.
Yeah, so people on the committee know, you may have noticed in your packet, I did work on the existing conditions portion of this. So it's 87% of individuals are within 3/4 of a mile of a transit line if it's in an urban setting, and 1/4 mile of a transit line if it's in a more rural setting.
Okay.
So proximity.
Gotcha. And that doesn't include ride source, correct?
That does include ride source.
That does include ride source.
Correct.
Okay, so do we have any idea how much? And you may not have this data. I know it's a bit of a technical question, but do we know how many people who are elderly and disabled that are not within the ride source area, basically not in the urbanized area?
I'm looking at
idea what percentage.
You know that 18% of the senior population are outside of those service areas, and 14% of the disabled population are outside of those areas.
And by those areas, you mean the fixed route?
The 3/4 mile and 1/4 mile buffers that he's describing. Yeah.
The reason I'm asking is to kind of to help move the discussion forward is that you get pretty good coverage within especially using ride source for people with disabilities. within the urban area where it gets tricky as you go out to the rural areas and how well covered they are.
Yes. Gino's got his hand raised. Gino?
So I'm wondering if we should be diving a little deeper into the age issue. For example, there are people age at different rates, not years, but in terms of their abilities. Some people are very mobile into a very old age. Some people are less mobile at a younger age. Some people, if you look at a dot on a map, and they're bedridden and cannot move from their facility or their home at all under any circumstance. That's another category. Is there a way to dive a little deeper into those age categories?
I will be talking in a minute about how we're planning some outreach, and particularly our survey tool that we've compiled that tries to get at that information, where we ask people, would you consider, I forget our wording. We have one question that asks respondents if they consider I wish I had the wording here. Delaney, you don't happen to know, do you? Our question about disability, where we try to be inclusive, we're not following any definition, just asking, oh, thank you, Kimberly. Say, how do you currently meet your transportation needs? Okay. Do you now, oh, I pushed the button. So the question that we asked that maybe helps us get at that is, do you now or in the past have a disability that substantially limits one or more major life activity? So that's not necessarily census data, right? We're trying to get the ground truth information from survey respondents that maybe gets closer to what you're asking.
Mm-hmm. One last question is, you mentioned veterans. I'm wondering why we're looking at that demographic.
I missed the demographic. Which one?
The veterans?
Veterans. It was a population that was identified specifically in the 2019 plan when we were talking about population profiles that may be of interest as we're brainstorming early on in this plan development. That was a group that came up, and you're the steering committee. If you think that's appropriate or inappropriate, let's talk about it.
Thank you.
Yep, Scott. So on the aging and disability question, how you phrased that question might really be putting off some people who might not want to be considered as a person with a disability. I am proud to be a person with a disability, but a lot of people in society still carry that stigma. So you might not really be getting down to the usability feature. And then going more on the usability, the current proposed plan is really relying a lot on like census level data, demographic data. I'm wondering if we can get data related to like stop level accessibility and sidewalk shoulder access analysis, as well as like paratransit wait times and how many stranded medical people happen on a daily basis, as well as mobility device accommodations and whether or not buses are fully accessible.
That is all terrific feedback. Thank you.
If I could just chime in there, we do have some ongoing work right now and some upcoming work that could help really inform those sorts of questions. So we're about to start an ADA assessment of all of our stops in the service area. Timing wise, we might not be able to have that work done by the time we want to have this plan adopted, but this plan could be referential to that work. So that would be one way to do it, so that if this plan gets out first, we can still refer to this other body of work. And then talked about paratransit wait times. We also have some other work that we're just wrapping up right now, our ride source operations and policies. I think it does have some specifics around that information that we can share with our consultants. That's great.
Very good. Thank you.
Dan, if I could jump in for a second. This is all really good feedback to hear, and I just wanted to let this committee know I'm grabbing this feedback as it comes. So we're definitely taking notes. Would love to hear from you. If it's okay, I'm just gonna screen share just to like, for transparency, like notes that we're grabbing. So, and I also have questions that people can refer to as you're thinking about things. So yeah, keep it coming.
Sorry, I know I'm not a member of the committee, but I just did want to respond to a couple of things I saw. I really like seeing the maps, the data that you're starting to collect. It's really helping to visualize big stuff. One of the examples you gave was the populations living in poverty. I think was one of the demographic measures, and something that we talk a lot about at Health Committee is populations that are just above the poverty level, but are still really struggling. And there's some really good resources. United Way's ALICE report, the asset limited, constrained, but employed report would be something I think of value, because that's a slice of the overall population. It seems like that population is growing. They're above the poverty rate at federal level, but they can't afford housing or transportation. So I think that might be an interesting piece of information as well. And then just sorry, my last comment, I noticed we showed sort of paratransit, fixed route, and then you also had TNCs and I think taxis on there. And I'm really happy to see that you have TNCs and taxis listed as something to look at, because I'm not sure how much knowledge there is of this issue within this community. I know some people are probably very well aware of it. There's no regulatory requirement for TNCs or taxis to provide accessible services in our largest cities. So that's an interesting thing to help service and start thinking about how we can address that problem.
Yep. Can I do on that note? Like, would it be possible to put it in a contract that they have to be accessible next time they would sign on the dotted line for right source?
Right.
Or for not right source, but like the taxi services.
If we have a contract with tech, and we do through our brokerage models, we do use taxis for our services, and those would be accessible, I think, for planning and private assistance. But just for general population, like if you want to take a TNC, for example, there's no, and you use a mobility device, there's no option or required for that vehicle for that service that makes for accessibility. Accessible options as far as.
And that's regulated through the cities, right?
That would be a city regulation. It's not something that we have direct control over, but it's something that we can have conversations with our agency partner.
It is an opportunity for coordination.
Yeah, absolutely. Yeah.
Just as a clarifying question, what percentage of LTV vehicles are accessible?
And when we're talking about accessibility, we're talking about people who are traveling in a mobility device, not people who can transfer, because those could potentially be accommodated with some of the TNCs.
Clarifying question on your clarifying. When you're talking about 100% accessible, are we talking about accessibility as defined under the ADA? Yes. Okay. Thank you.
I was just going to echo the comment that both Gino and Scott made about especially the senior population, and drilling down on, is there a desire for more transportation options for some of the senior population living in these different areas? I think that was kind of what Gino's point was, is if they are not leaving home, or if they have other means of getting to where they need to go, it seems as though it would be good to know that, so that any plan updates are targeting the people who are most in desire of services. Just because you're over 65 doesn't mean you desire services. And same thing about the disability question. There's, my father-in-law would never tell you he's disabled, but can he walk a quarter mile to a bus stop and stand and wait? No.
When you say, when you ask what definition we're using for accessibility, are we being exclusive in using that definition?
Oh, I was just clarifying for my own knowledge. I'm hoping that, eventually down the road, we will be seeing varying definitions of accessibility to be more inclusive of people with learning disabilities, mental health disabilities, different processing speeds, things along those lines. The ADA was just the bare minimum for protections.
That's great feedback.
In Florence, we've had for I don't know how many years now, the Friends of Florence, which is that bus service that runs between Florence and Eugene, Springfield for cancer patients. Is there any talk about your coordination with those guys? That's an expensive operation. I was the president for several years.
Yeah, I know you are involved in that part. Carrie should put that in notes, talk about like reaching out to them to get for outreach when you're trying to gather information.
Could you repeat your question?
Yeah, it's the Friends of Florence, which is a nonprofit Florence that provides transportation for cancer patients for radiation treatments. It's a quick back and forth. But yeah, they've been doing it for a long time by themselves. And is there some way to coordinate with LPD to increase the? They're talking about maybe expanding it. I've heard rumors from some of the board members that expanding it to actually go to River Bend for treatment. So there's options for maybe to grow. That's about some of the problems with Florence because we're way out there in hinterlands, and to any medical stuff you have to go to Eugene.
Yeah, Bart, thank you for mentioning that. We'll definitely follow up with that group.
It is surprising the proportion of the population who are older adults who live outside of the metro area, because a lot of people as they age want to live closer to services. But I'm thinking that there's probably a lot of reasons that they don't, and it could be things like income, what other considerations. So to me, the proportions is pretty surprising.
And in Florence, we have 2 retirement communities that will age out. They don't want to go. They don't want to leave. They don't want to do anything. This is where we live. So when you get services, then that becomes an issue because you have to go to Eugene now, whatever. So.
Maybe we can move on at this point. Thank you for the input. That is all very helpful. Can we go back to the presentation? Next slide. This is the other section I wanted to talk about. We really don't have much content for this yet, the needs assessment. It is going to rely heavily on the input that we receive through our outreach and engagement with our stakeholders. But we do have an outline and we do have an idea of how that section is going to be populated, what it's going to look like. It will have these 3 subsections. So first, identifying who are our stakeholders, description of our engagement efforts with those stakeholders, identifying gaps, issues, and opportunities, and then a section where we do an assessment of what local planning and coordination efforts are currently underway that are aimed at improving mobility. Next slide. So as I mentioned, we haven't put a whole lot of content together, but what we do have so far, we have a project web page, which is nearly ready to go. And we have put together this survey, which we're intending to use as a tool for outreach and engagement to collect some additional data that can help us complement the other more hard data that we have. Maybe hard's not the right way to say that. We want some real data, right, from people with flesh and blood to complement the digits that we have. Next slide, please. Oh, not yet. Well, yeah, that's fine. So tiered engagement, which is really what the next slide is. So we, through our public involvement plan, at the beginning of this process, we inventoried stakeholders and we were talking about how to engage them best and trying to be most efficient with our time. And we've developed this kind of 2-tiered approach So we have agencies and groups and organizations that we want to hear from, but there's maybe a more broad group where we're going to engage a little differently, and then maybe a group that's maybe a little more narrowly focused, who's probably maybe a little more directly relevant to the work that we're trying to do, specifically that work with older adults or people with disabilities, for example, but not limiting ourselves necessarily to that. So our idea with that engagement is that second group, the more broad group, we're focusing on getting the survey out, hearing from as many of them as we can, looking to the organizations to help us disperse surveys and get as many responses as we can to hear from them. With this first group, the more focused group, that's face-to-face interactions, that's interviews and focus groups, really wanting to get as much as we can from these groups. So in your meeting materials, there is a sheet that looks like this. Those of you who are online, sorry, it's 2 columns, a listing of organizations that are in 2 different groupings here.
Page 20 to 21.
Thank you. Page 20 to 21. This is we've kind of looked at this and put them into these 2 groups that I mentioned. We'd love your feedback on this. First of all, are there groups that are missing? But secondly, do we have these in the right place? Do you think that this works? Do you like this approach? We'd love your feedback. I think the next slide, before I open this up, just has some other those questions that were included for this section that we're hoping we can discuss as well. I think we're going to just open up for discussion now, starting here, but anything that you have regarding our public outreach, we'd love to hear about it now. Yes?
Oh, I was just going to say Gino's got us.
Oh, that way. Gino.
Yeah. Thanks again. Are we talking to the drivers that are providing the service to see what they're seeing and get their input?
I don't think the operators specifically have been identified as stakeholders in this. So
I think they can provide some valuable insight.
Yeah, thank you for that input.
Thank you.
Two groups that I would know would probably be the Oak Ridge shuttle service, so either Trans-Cascadia or the other one. It's Trans-Cascadia and it's off of Cogwild. So they'll probably be 2 because they're the ones that run the shuttle service in and out from Eugene and Oak Ridge. And then another one, I don't know if it counts under LTD, but it's the LCTEA committee, which is the Lane County Transit. Give me 1 second, I'm looking at it right now. But essentially they are a committee that meets, I think, every second Wednesday, and they focus on just transit, disability access on transit, also older. So basically everything that you're hitting. And that's basically what we talk about every 2 Wednesdays. And it is part of the, 1 second, I will find it. It's quite a long name. So, to memorize. All right, so it is the Lane County Public Health Advisory. They just called it LCTA and everything. Sorry, one moment. Write your name. Yeah, it's gonna take me a while to find it, so just give me a moment.
Carmen, do you know who coordinates that?
It's Joe. It's with the Lane County Public Health Emergency Preparedness. It's just the name of the actual thing is acronymed in every meeting that I have.
It sounds like someone we definitely want to include.
Yeah, definitely. This is what they talk about every second Wednesday.
Yeah.
So I'm like, hold on. Literally, even in the meeting notes, it's LCTA. Okay.
I don't know a lot about the organization, but OSLP, does anyone else know about that group? Oregon
Supported living.
Yeah. I didn't see them on the list. Don't know if that would be another helpful group.
I work for SLA's Outreach Services, SOS, in Florence. They do a lot of
Sorry, could you repeat that again?
Latest Outreach Services, SOS. Bob Teeter is the director.
I also could suggest reaching out to the family networks. I think they're called like the Oregon Family Support Consortium, but basically every rural community and urban community has a group of parents who have kids with intellectual and developmental disabilities, and then they're connected with the schools and everything else, so it would be a good touch point.
Great.
I would only suggest if you could reach out to probably one of the tribal units or organizations and see how their disabled populations or elderly populations are being served. For example, Fort Florence, we have the, if I get this acronym right.
CEDACLUSI.
Yes, CEDACLUSI. That would be a good group to actually touch. And I think coming into town, or at least already into town, there's also the one down in Coos Bay. Let me get the name right. It'll come to me and I'll tell you.
Thank you. Yeah, great.
Because those are two tribal communities that have those types of populations. Coquille. Thank you. Yes, I didn't want to say it wrong. Yes.
Thank you.
That'd be a good source for the practice.
Yeah.
As just throw it out as an idea, not saying that it needs to be added to the list, but other service organizations like Rotary or something like that, because that might be people who are advocating on behalf of other people that you wouldn't necessarily reach otherwise.
Are we doing on time?
About 5 more minutes for this agenda item.
Great.
Seeing Lane County Mental Health, is Lane County Mental Health okay? CHS.
We'll add it if it's not.
And then a correction on that, that was the Oregon Family Support Network on my last one.
All right, great. So as I mentioned, we have finalized this survey. We're not quite ready to go live with it, but we would love to have your support in disseminating that survey. We'd like to get it a broad reach, as broad as possible, not just these groups, but definitely these groups. Any other comments that come to you, please submit them, send them by email, save them for next meeting, or offer them right now if you got them on the tip of your tongue. I don't want to cut anybody off.
One other observation is you mentioned the website and a survey. How is the survey electronic?
It is, with the option to print and provide in paper on request and in Spanish.
Okay, because I was also thinking a website. Some of the seniors I know are not real computer or web savvy.
And people in the disability community as well. The digital divide is huge, especially in these two communities. I think it's going to be essential that you make it not digital and not by request. You shouldn't have to opt in to be able to access the survey. So I think that's going to be really crucial, whether it's mailing out or whatever it may be.
Library, it's like a public library, which takes a lot of different books.
Yeah, thank you for saying that. We definitely want to bridge that digital divide. So we're working, as Dan mentioned, we're working on having that paper survey available. If you know of an organization that would be happy to just like have a survey for someone to pick up and we're working on our in-person engagement as well. So like if you have folks that would be willing to partner with us and just help us bridge that divide, we definitely would love to hear from you. So yeah, we're definitely thinking about that and want to just expand this outreach as much as we can.
Lila came up with that one.
Awesome, thanks, Scott.
So thank you, everybody. This has been really helpful and we appreciate your comments. If you go to just the last slide. One more. There we go. So I'll be presenting here again in February just to provide update on how those sections are coming along, let you know how our outreach and engagement is progressing and how that's moving forward. And then introducing a couple more sections for you. But thank you again. I appreciate you taking the time and hearing me out. And this has been really great feedback. We've been taking vigorous notes. Thanks.
Thank you, Dan. Final agenda item of the evening is staff updates and future agenda items.
Yes, thank you, Josh. I've got a couple of things to go over. First, in terms of agenda items for our February meeting, as Dan just said, we'll be presenting again on some other upcoming sections of the coordinated plan. I hope to have another legislative update for you to follow up on the one we had in October. Hopefully there'll be some news to share in February. And then one crucial thing that I had mentioned in our last meeting, we'll be doing elections for a new chair and vice chair in February. So I wanted to encourage everybody to give some thought to whether you'd be interested in taking on either of those roles. If you have any questions, feel free to reach out to me. Happy to answer any questions. I provide plenty of support for folks in those roles. So you will not be all on your own. So give it some thought and let me know. Connected to that, I wanted to share that LTD is currently reviewing bylaws for all of its committees. We've had our legal team review the bylaws for this committee, and they've made some suggested changes. Nothing radical. They've updated it so that we're in compliance with OARs, which have changed since the last set of bylaws. One change that is going to affect our elections, though, is that they're planning to switch us from a calendar year for a term to the fiscal year. So we're going to have a 6-month window between January and end of June in 2026. We're sort of in no man's land. So we're going to do an election in our February meeting to cover those 6 months, and then we'll just elect again in July or whenever we meet right after July 1. And so we'll just get very good at doing elections. I will get you a copy of those bylaws as soon as they've been approved. They're going to a bylaws subcommittee to be reviewed at LTD next week, and then our board of directors needs to approve them. So once I have a final approved version, I'll get that out in an email to everybody so you can all take a look at those. But as I said, no drastic changes. What else? You probably saw in Dan's slide that he had us slated to meet in May to give a seal of approval before the coordinated plan goes to the board. So I will be scheduling a May meeting, and then I'll also be working with Brianna to look at the calendar for our upcoming meetings. Starting in mid to late summer, we'll be moving into planning for the next STIF biennium and looking at budgets and project plans. And so I will start sending out some invites for calendars as well for that period. And our meeting cadence will increase a bit at that time. We'll be meeting at least monthly, maybe toward the end, twice in a month, to make sure that we get everything settled for the STIF plan and are able to submit that on time and get it to the board and get it through all its hoops. And I think that is it for the updates that I had. Any questions from anybody?
You want to mention the correction of the February date?
Oh, yes. The February date in the agenda is off by 2 days. It's actually our meeting is, as your calendar invites show, there at February 10th, Tuesday, February 10th at our usual 5 p.m. time. And we'll be here in this room again. The boardroom's still under construction, so we'll be here. Thanks, Bree.
Any other questions for Kathleen on that? Thank you. Anything else for the good of the order? Yes.
So I just
Lisa?
want to say thank you to LCOG for doing such a great presentation. That's really a great presentation. And also to Kathleen for doing the presentation earlier on the Diamond Express, for the Express. Both really good, informative presentations. Thank you very much. One question for LCOG. So we went through some lists and some information today. We have feedback when we go home and think about this. We think about more groups maybe to include or more things to consider. Who would we provide that to?
I would suggest that anybody on the committee, everybody's got my email address. Just if you think of anything else, any comments, questions, groups you want to add, just shoot it to me and I'll make sure it gets to Dan and Carrie.
Well, I think so, since we're still here. It was the Lane County Transportation Equity Assessment. That's the name of the committee.
Oh, thank you. Thank you.
Way to go.
Yeah, I also found upstream river access while there. And my last comment for LCOG was that there is also just the whole thing of people who have cars but currently shouldn't drive them or can't fully drive them, but they still try to reach the resources that we have, which we have a lot of in Oak Ridge, and that was last of it. So
Thanks.
And the same thing in Florence.
Yeah.
Thank you. And with that, I'm going to call the meeting adjourned.
Good job.
Excellent.